So there is a table in ophthalmology, like you have to learn the action of extraocular muscles. Extraocular muscles have primary action, secondary action, tertiary action and all. So I'll just teach a simple method for you to memorize it. Okay. So our extraocular muscles are medial rectus, lateral rectus, superior rectus, inferior rectus, superior oblique and inferior oblique, and they have got primary actions, secondary actions and tertiary actions. So we will fill this table. There are some tips to remember this. So the first one is recti muscles are straightforward muscles. That is, superior rectus means it elevates the eye. So as the name is their action. So for example, the recti muscle gets attached to the eyeball straightforward. Superior rectus like that, medial rectus, lateral rectus and inferior rectus like that. But oblique muscles attach to the eyeball obliquely. That is, superior oblique attaches like this, obliquely. Inferior oblique like this. So the main function of oblique muscle will be this. That is intorsion and extorsion. So suppose this is nose and this is eye. The actions are adduction, abduction, elevation, depression, intorsion, extorsion. So now we will see the muscles individual actions. So medial rectus. What is the action of medial rectus? It will move the eye medially. That action is called adduction. So that is the action of medial rectus. Lateral rectus will move the eye laterally, so that is called abduction. So this medial rectus and lateral rectus doesn't have any secondary or tertiary action. They have only primary action. So that is easy. Now to the next muscles. I have told you that the superior rectus, inferior rectus are straightforward muscles. So superior rectus will be elevator. So that is the primary action of superior rectus, elevation. And primary action of inferior rectus will be depression. I have also told you oblique muscles are obliquely attached. So their main function will be either intorsion or extorsion. So superior oblique, inferior oblique, primary action will be either intorsion or extorsion. For that we have a code. That is sin. Sin means superiors are intorters. So what will be the primary action of superior oblique? Intorsion. Inferior oblique, extorsion. Now there is no secondary tertiary action for medial rectus and lateral rectus. But for these four muscles we have secondary and tertiary action. So superior rectus, inferior rectus can elevate, depress, that is their primary action. They can also do intorsion, extorsion, but that is the secondary action. Same way, superior oblique and inferior oblique can do intorsion, extortion, that is their primary action, but they can also do elevation, depression, that is their secondary action. So we will fill this table again. So what is the secondary action of superior rectus, inferior rectus? I have told you that it is either intorsion or extorsion, but code remains the same. So superior rectus secondary action will be intorsion, inferior rectus secondary action will be extorsion. Now I have told you superior oblique, inferior oblique can do elevation, depression, that is their secondary action. So for that just remember O for opposite. So superior oblique depresses the eye and inferior oblique elevates the eye. So secondary action of superior oblique will be depression and secondary action of inferior oblique will be elevation. Now the tertiary action. So these two muscles, lateral rectus and medial rectus, have got only one action, adduction, abduction. If that action is done by any other muscle, that is going to be the tertiary action of that muscle. So for that we have a code RAD. So tertiary action of these muscles is going to be either adduction or abduction. We have the code RAD. That means recti are adductors and obliques will be abductors. So superior rectus and inferior rectus tertiary action will be adduction, and superior oblique and inferior oblique tertiary action will be abduction. So in this way you can remember this table very easily and it will never get confusing. Thank you.